Hello everybody, so today's topic is going to be on the topic of peroneal tendon subluxation, dislocation, and also chronic tendon snapping problem. So when it comes to subluxation, sometimes that can actually occur as a result of an acute injury. In terms of the mechanics of injury or how it actually occurs, it can actually occur due to the high force dorsiflexion and high foot inversion. For chronic snapping tendon problem, in other words repeated subluxations, could be the result of repeated ankle sprains. Sometimes that can actually happen to people with chronic ankle instability following a lateral ankle sprain. Although this is not very common, this can actually happen in sports such as hockey. In the lateral compartment of the ankle, general ankle stability is provided by some of the ligaments in the area, which actually includes the ATFL, the PTFL, and the CFL. The peroneal muscles, also known as the efferents, their tendons are actually held together by important fascial structure, also known as the superior peroneal retinaculum and the inferior peroneal retinaculum. Damage to the synovial shaft can actually cause the tendon to track out of place. In terms of what the person may experience, they may feel that there may be pain in the back of the ankle, also tenderness close to the tendon region, and they may also find that with activities, it tends to get worse. There could be swelling as well, and within a stable ankle, there may also be the presence of a clicking sound. And in an acute incident, they may sometimes even hear a popping sound. And for the chronic snapping ankle tendon problem, sometimes what they could experience is also the ability to be able to snap the tendon back and forth during dorsiflexion or eversion. In terms of assessments, according to Sabel et al., compression tests can actually be performed to examine for pain, clicking, or popping at the distal fibular end when performing ankle eversion or dorsiflexion. Another type of testing that can also be performed is apprehension test, which is actually a similar maneuver but having the patient perform the movement actively. In terms of risk factors, hindfoot varus may potentially be a problem. Also, neuromuscular disorder such as Charcot-Marie tooth, lateral ankle ligament laxity, also low-lying peroneal brevis muscle, and also increased activity stress. Some of the management strategies for acute peroneal subluxation may include immobilization for 6 weeks. It is also important at this stage to refer out to a primary care physician or qualified specialist for further diagnostics. MRI or diagnostic ultrasound at this stage can be helpful to identify the presence and severity of any damage to the tendon. If needed, some surgical management examples include direct tendon repair, retromalleolar groove deepening, and also tendon rerouting. And in the chronic case of a tendon snapping problem or ankle instability, conservative management examples that actually helps the target to improve the peroneal strength, intrinsic foot muscle strength, also reaction time, proprioception, load management, and also addressing any faulty biomechanics and kinetic chain would be helpful to restore ankle stability, therefore reducing the risk of another possible injury. Therefore, it is important to seek for medical and clinical advice from a qualified physician, specialist, or physiotherapist for an appropriate intervention plan. If you like these videos, be sure to like and subscribe for more.